Joanne.
Hi, how are you?
Dr. Mehele Kumanen practices in Cambridge. She has been a family doctor for 15 years.
There's so much that I love about being a family physician.
Fewer and fewer med school graduates seem to feel the same way, with the number of people choosing to specialize in family medicine dropping every year. Plus, a growing number of family doctors are either retiring early or opting to work in other fields.
Family physicians truly are small business owners. And so I think a lot of family physicians are just looking at the numbers and not feeling that this is a sustainable option for them to continue in practice.
There are now more than 5,000 fully qualified family doctors in Ontario who are not practicing family medicine full-time.
We need to try and encourage these people to get back into a comprehensive care family practice as much as possible.
Let me check those little eyes.
So why this reluctance? Many say it's a financial thing, that family doctors' earnings are being eroded by inflation.
We have to pay the bills, and if compensation hasn't kept pace with the rising costs of running a business, it becomes quite a challenge.
Ontario has two systems for paying family doctors. In the model called capitation, the doctor gets a flat fee for each patient on their roster that varies by age and sex. For a male patient in his early 60s, the doctor gets about $250 a year. In the fee-for-service model, OHIP pays the family doctor for each procedure, and for the most commonly billed office visit, the doctor gets $38.
I got a haircut yesterday and it cost me $40.
Family doctors have to pay their staff and office costs out of their OHIP fees.
You get to the point where you will have to contemplate whether you'll be able to continue on in that field or you'll have to pivot to something else.
Another factor, family doctors say they now have less time to see patients because they're stuck spending more and more time on administrative tasks, medical paperwork that they don't get paid for.
Paperwork is a huge source of burnout. That needs to be fixed because there are a lot of inefficiencies, a lot of duplication, a lot of things that gets dumped on us in terms of administrative work.
The Ontario Medical Association is bargaining with the government now on the contract that covers how nearly all doctors in this province get paid. Compensation for family doctors is firmly in the spotlight.
What we need to do is make sure that physicians' real income keeps pace with inflation, just at a fundamental level.
We asked the Premier, are you willing to pay family doctors more?
I want to thank all the doctors out there. You're all absolute champions, and we'll be able to come up with a great deal.
Some doctors are hoping the Ford government makes a deal like the one reached in British Columbia. That province now pays family physicians for medical admin work, things like doing referrals or reviewing lab results. And in the years since that began, 700 more physicians have opened family practices. Mike Crawley, CBC News, Toronto.